Oh, bleeding hell. Why your gums bleed and what to do. Medical tip. If you bleed when brushing your teeth, something is wrong. You might be brushing too hard, but it might be a sign of gum disease, which isn't brilliant for you. The clue is in the word disease. In its early stages, it's known as gingivitis. Symptoms include red, swollen, and bleeding gums. It generally occurs when your gums are irritated by the sticky film of bacteria known as plaque. Don't worry though, it's totally treatable. Get checked by your dentist. Make sure you floss. And brush your teeth for 2 minutes, twice daily using a fluoride toothpaste such as Corsodyl. It's what the NHS calls good oral hygiene. And it also doesn't hurt to eat healthily, as a lack of nutrients can make your teeth and gums more vulnerable to problems. Left untreated, gingivitis can turn into periodontal disease, which is irreversible. We'll spare you the details because it gets pretty icky, but we're talking pus, abscesses, and your teeth coming loose. Actually, sorry, those were the details. Whoops. Still, never mind. You are now aware of some options to help stop and prevent bleeding gums. Remember, healthy gums don't bleed.